Dengue fever is one of the most serious mosquito borne diseases affecting tropical countries, especially the Philippines. Dengue is caused by dengue virus, which has four serotypes: DN1, DN2, DN3, and DN4. Once infected with one type, a person gains lifelong immunity to that type, but not to the others, meaning reinfection with a different type can cause more severe illness. The disease is transmitted primarily by the Aedes aegypti mosquito, which thrives in clean, stagnant water. To address this, the Department of Health spearheads the Integrated Dengue Control Program, which aims to reduce morbidity and mortality through surveillance, community mobilization, and preventive action. As community health nurses, we play a critical role in community based dengue prevention, especially in health education, surveillance, and environmental management. Dengue outbreaks occur year round, but they peak during the rainy season when water collects in containers, tires, and gutters, creating ideal breeding sites for mosquitoes. Children are the most affected group, often due to exposure at home and school, and because their immune systems are still developing. Urbanization has also increased dengue risk, resulting to poor waste management and unplanned housing, leading to more breeding sites. The Department of Health notes that dengue has shifted from being a seasonal disease to a year long health threat, especially in densely populated areas. This reminds us that environmental management and community involvement are just as important as clinical management. Dengue is caused by the dengue virus, transmitted through the bite of an infected Aedes mosquito, particularly Aedes aegypti and Aedes albopictus. And like malaria carrying mosquito that bite at night, Aedes mosquitoes bite during the day, especially in the early morning and late afternoon. They breed in clean, stagnant water, not dirty water as many believe. Common breeding sites include flower vases, tires, tin cans, and uncovered water containers. This is why dengue prevention focuses heavily on eliminating mosquito breeding sites and changing community behaviors, because these mosquitoes thrive close to human settlements. The classic presentation of dengue includes sudden high fever, severe headache, and joint pain, often called breakbone fever. Other symptoms include nausea, vomiting, skin rashes, and mild bleeding, such as nosebleeds or gum bleeding. In severe dengue, patients can develop plasma leakage, shock, and multi organ failure, which can be fatal if not recognized early. We are reminded that community awareness of symptoms is vital because timely recognition and prompt consultation can save lives. When in doubt, any fever lasting 2 days or more during rainy season should be checked for dengue, especially among children. Diagnosis of dengue is based on clinical symptoms and laboratory confirmation. Rapid diagnostic tests like NS1 antigen detection or serologic testing confirm infection. There is no specific antiviral drug for dengue, so treatment focuses on supportive care, hydration, fever management, and monitoring for warning signs such as abdominal pain, persistent vomiting, or bleeding. Early recognition of these signs can prevent shock and death. Public health nurses must emphasize the importance of early medical consultation and avoidance of self medication, particularly with aspirin or NSAIDs, which can increase bleeding risk. The DOH advocates the 4S strategy for dengue prevention. 1. Search and destroy, or eliminate mosquito breeding sites. Second, self protection. Use repellents and wear protective clothing. 3. Seek early consultation. Visit the health center at the first sign of fever. 4. Support fogging. Participate in fogging operation when there is an impending outbreak. Weekly cleanup drives help remove breeding containers and maintain sanitation. Collaboration with schools, barangays, and community organizations ensures that program is sustained. Effective prevention doesn't rely on the healthcare team alone. It depends on how well communities adapt and practice these measures. Health education is the heart of dengue control. We need to teach households to cover water containers, change flower vase water weekly, and properly dispose of garbage that can collect rainwater. We also encourage community cleanup drives before and after the rainy season to eliminate potential breeding sites. Education should highlight that dengue mosquitoes breed in clean water, correcting that misconception that only dirty water is risky. Finally, we promote early consultation for suspected dengue cases. Early detection and hydration can mean the difference between recovery and fatal complications. In the Integrated Dengue Prevention and Control Program, we conduct dengue surveillance, ensuring that every case is promptly reported and managed according to DOH guidelines. We also lead community campaigns that promote the 4S strategy, serving as advocates for behavior change. Nurses coordinate with schools, LGUs, and households, integrating dengue education into barangay assemblies and health fairs. Our presence in the community allows us to bridge the gap between national policy and local action, turning awareness into sustained community engagement. To recap, dengue control depends on community effort and environmental management. The most powerful defense against dengue is still prevention, eliminating breeding sites and promoting hygiene and awareness. We nurses play a crucial role in advocacy, education, and surveillance, guiding communities to take responsibility for their environment and health. Disease prevention is the most effective way to empower our communities. Consistent application of the 4S strategy and continuous community collaboration can significantly reduce dengue incidence and bring us closer to a healthier, dengue free Philippines.